Are you trapped or feeling trapped on acid-reducing medications like PPIs, Prilosec, Nexium, Protonix, and maybe you're terrified of the long-term side effects or problems that you've been hearing about? We're definitely not alone. Millions are in that same boat with you, and doctors often don't tell the whole story of these medicines and how you should get off them and what these consequences are. That is that PPIs fundamentally work by shutting down the acid pumps in your stomach, and it's great for the short-term relief when you need them. But long-term, things are not so rosy. It can mess with your digestion, the fundamental digestive process that you need in order to get the nutrients out of your food, and can even lead to kidney, heart problems, bone problems, and other issues. And so today we're going to expose the truth about long-term PPI use, and more importantly, give you some real solutions to help you along that path. Hello and welcome. My name is Dr. Taranella, and this channel is dedicated to helping you optimize and improve your health. Today, we're tackling this issue of long-term PPI use and consequences. And I know a lot of you are on these meds and want to get off them, but you can't, or you're not sure how to. Wait, how did he know that? Is he reading my mind? Nope, not a mind reader. What I did is I went through the comments on my videos and other videos, and I saw the same reoccurring concerns, fears, and struggles about taking these PPIs and the problems that they're causing. And so this video is for you. If it resonates with you, hit that like and subscribe to continue getting these videos. Well, let's get started. We often don't think about it, but the acid in our stomach is essential for a lot of things. It helps us digest our food, which is important to absorb key nutrients like calcium, magnesium, iron, B12, and many others. And it also helps to keep the harmful bacteria in our digestive tract in check. PPIs, or proton pump inhibitors, and similar acid-reducing medicines drastically reduce that acid, which helps with the acid reflux symptoms that you may be having. But in the long term, this can create a whole new set of problems, issues for you. So this really isn't just about heartburn and managing your heartburn. It's about understanding your overall health and the importance of the digestive capacity on different aspects of our health. For example, long-term PPI use is definitely linked to specific nutrient deficiencies, which can lead to fatigue, nerve problems, bone fractures, weakness in the muscles. It can also lead to kidney disease, gut infections like SIBO or Clostridium difficile, sometimes heart problems like increased blood pressure, and some people even get rebound hyperacidity, so they're really basically stuck on these medicines. One viewer commented, for instance, that I've been on PPIs for over 20 years. My doctor never told me it was supposed to be temporary. Now I have B12 deficiency, irregular heartbeats, and my kidneys are declining. This is a common thing that I see in my practice, is people just get put on these and never have a strategy for coming off. And so it's a real problem and a real concern for those people that are on these. And so that's what we're going to do in this video here, is explore some of these long-term risks a little bit more, and also help you understand what some of the root causes are for acid reflux. So hopefully you can unwind this problem with the help and support of your doctor. But before we jump into that, I just wanted to expand a little bit on this topic of the problem of PPIs. And yes, they are pretty much handed out like candy, as if, there's no long-term consequences. And so there's that lack of awareness by the provider and also the patient if that information is not passed on. But then sometimes when they do try to come off of them, maybe they are told that they should come off of them, then their acid reflux is going to be worse. And now they're suddenly trapped on this medicine because of the pain and discomfort that they now have from the rebound hyperacidity. Another problem too, though, is that many people actually don't have high acid states to begin with, and they're taking PPIs and they actually don't need them. They actually have low stomach acid. One viewer commented that it turns out I didn't produce enough stomach acid. And once they figured that out, they didn't need the PPIs anymore. But you can imagine that that problem was getting worse as they're on those PPIs. So what's really going on inside your body, inside your digestive tract, when you take these PPIs long term? So let's break this down a little bit. So at the core is going to be nutrient depletion. And I think this kind of branches out into all the other problems that occur with long-term PPI use. They definitely are going to reduce the amount of calcium absorption. We do need acid to absorb calcium, and long-term PPI use has definitely been associated with increased incidence of hip fractures and fractures in general. And this is a common theme throughout some of the comments that I read, is broken wrists, broken hips after years of PPI use. So this is a real thing that happens to people. Magnesium deficiency is also really common, and magnesium is essential for many different functions in our body, like our muscles working properly, blood pressure, muscle spasms are common, and PPIs interfere with magnesium absorption. Acid is also needed to convert iron into a more absorbable form. So that's why we see with PPI use, you commonly do have anemia or low iron states. It doesn't happen to everybody, but I have seen this as a theme in my practice. Similarly, vitamin B12 needs something known as intrinsic factor in order to absorb B12. An intrinsic factor is produced in the stomach. The PPIs and other similar acid blocking drugs are going to inhibit the intrinsic factor formation, and that's going to lead to B12 deficiency, which has a whole host of other problems that it can lead to: neurological, brain, mood, and of course, energy. And your comments actually echo this, that you're developing B12 deficiency, and this is extremely common from PPI use. Downstream, because of the lack of acid, there's imbalances that are going to occur in the microbiome as well, like Clostridium difficile. The stomach acid is basically one of the checks and balances to keep these bad bacteria in check. And we are supposed to have some of these microbes there, but if you don't have enough acid, they can start to overgrow or overstay their welcome. And PPIs are going to lower the defenses for things like C. diff and also SIBO, allowing these microbes to kind of thrive in the small intestine environment, which is going to lead to malabsorption, gas, bloating, and overall discomfort. PPI use is also connected with kidney issues and kidney damage when you're on them long term. The exact mechanism is not really understood and still being researched, but there is a link there, and I suspect that it's probably linked with one of these nutrient deficiencies. And a lot of times when people try to suddenly stop these PPI use, they're trapped, because when they stop, it causes a massive surge in acid production, and their acid reflux is suddenly worse. This is why many people get stuck or feel stuck on them. But of course, this doesn't happen to everyone. So it's important to understand that the PPIs don't just suppress the acid in the stomach. Well, they certainly do, but it has downstream trickling effects that fundamentally alter the digestive tract environment, creating this kind of cascade or wave of problems throughout not just the intestines and digestive process, but throughout the entire body. And this is a classic example of treating the symptom and not the root cause. And so some of the things that I mentioned above are actually really well researched, and we don't need to go into that too much here. Instead, let's look at some of the strategies of getting off PPIs and addressing the root cause. And of course, you want to do this under medical supervision. You don't want to just do this on your own without any guidance. Some people are going to need to stay on these, so you don't have to feel like you're forced into coming off these because it's going to cause all these problems. There are other alternatives too. So this is a video that's specifically for people that are wanting to come off of them and want to understand some of the implications. Some people, for instance, need to have surgery if they have severe hiatal hernia. You may need to stay on these. But just because you have hiatal hernia doesn't mean you can't come off of the PPIs. Just remember to talk to your doctor before making any changes to your medications. So in trying to understand what the underlying cause is, one of the most common culprits is the food that you're eating and the timing of this food. Some of the common culprits, so these are going to be fatty foods, spicy foods, chocolate, caffeine, alcohol, citrus, and tomatoes. These all contain higher amounts of histamine. And for people that are producing high acid states, which is common with this problem, these foods are going to definitely make that worse, especially if you're thinking about coming off of them. You want to drastically reduce those foods during that interval when you're coming off to prevent that hyperacidity state. As I said, sometimes there's structural issues like hiatal hernia, and that may need to be surgically fixed in order to not have this acid reflux problem. But not everyone with hiatal hernia is going to have acid reflux, which means just because you have that doesn't mean you need to be on PPIs or acid blockers. As we mentioned above, sometimes people have low acid states, or what's known as hypochlorhydria, and there are ways to test and understand that. There's a Heidelberg test, or you can also do a Betaine HCl or hydrochloric acid challenge. Of course, you want to do this with some doctor supervision, but many people, my patients included, find that their acid reflux actually goes away or is significantly reduced just by taking more acid, not by reducing the acid. There's also the possibility that you actually have an infection of H. pylori in your gut. When you have H. pylori, it's going to increase the acid production and cause more pain and discomfort in the stomach and esophagus. And that's something that can be tested for and treated. Once eliminated, a lot of these symptoms are going to get much better. Equally important, I have people that have small intestinal bacterial overgrowth that are put on PPIs. And once we identify the SIBO and treat that, their acid reflux symptoms basically go away and they're able to come off of those medicines. There's also a whole bunch of lifestyle interventions that can be helpful, like losing weight, elevating the head of your bed so that the acid has a harder time traveling up your esophagus, avoiding late night eating. So you want to have several hours between when you eat and when you go to bed, so that there's not as much pressure in the digestive tract pushing up on the stomach and the valve. The more pressure there basically pops open the valve. And if you eat more and then lay down, it mechanically allows for that valve to open a lot easier. Along the same lines, eating smaller meals can be very helpful too, and avoiding certain foods that are going to cause more gas and bloating, like a low FODMAP diet, can also be helpful. Of course, that is going to be more helpful if you have SIBO. And if you find that helps, you need to get the SIBO treated. There are certain natural remedies or supplements that I use in my practice to help with this too. We mentioned the betaine HCl. This certainly can make people worse if they have an ulcer, so you really have to be careful with how you introduce that one, but it can be really helpful in the case that you have low acid states. Equally helpful can be digestive enzymes, and they're going to, again, help with the overall breakdown so that there's not as much gas, bloating, and the mechanical mixing, which can sometimes create bloated feeling and pressure in the stomach area, which can push up against that flap, allowing for acid reflux to occur. DGL, or deglycerinated licorice, is something that's really soothing to the esophagus and the stomach, and also works as an anti-infective against H. pylori. You just have to remember, if you're using it to treat H. pylori, it probably won't eradicate it, so you're going to be stuck on it for life. And if you are going to get tested for it, you don't want to be taking the licorice when you go in to get tested. Slippery elm is another herb that can be really helpful at soothing the mucous membranes and enhancing the mucolytic activity in the digestive tract. So it can work as basically a palliative type of thing to reduce the irritation and problems that you're feeling in the esophagus. And then the last thing we want to cover is weaning off, or how do you actually get off of the PPIs. And the general idea is here is you want to do it gradually and under the supervision of a doctor. Typically, I don't advise people to just stop them cold turkey, because you probably will get that rebound hyperacidity. Going off slowly is your best option. So that means reducing from 40 milligrams to 20 milligrams, 20 milligrams to 10 milligrams. Depends really what you're on, but you really need to run that by your doctor first. Sometimes going from a PPI to an H2 blocker is also a nice step down, because the H2 blockers are less intense about how much acid they're going to reduce. But again, you can have rebound hyperacidity from that. And we can use some of these natural supplements and natural means to make that transition a little bit smoother. So if you're on long-term PPIs and want to explore some safe ways to get off them, I do have a course on digestive health that you may want to check out. It's called Digestive Reset, and I'll put a link in the description if you want to explore that a little more. So now that we got the details of this problem hammered out, let's look at some of the key takeaways that you need to remember. First one is the long-term risk of PPIs are significant for nutrient deficiencies, and then also what those deficiencies are going to cause, like infections, blood pressure problems, nerve problems, etc. Many people are on PPIs long-term and don't really need to be. They're just on them because no one ever told them to stop. And sometimes the hyperacidity that happens when you try to stop can make it a lot more difficult for you to stay off of them. And that's where finding the root cause and working through some of these things that we discussed in the video can be really helpful to make that transition. If you're worried about the hyperacidity, some people actually have low acid states, and that's much less likely to happen in low acid states. So you may not have any symptoms trying to come off of these. Still, you never want to stop these medicines abruptly. You definitely want to loop your doctor in to make sure that you're not putting yourself at risk. There are various reasons why you definitely would want to stay on them. So this is not a one-size-fits-all for the whole population. This is just for general purposes and informational purposes. But if you are making that transition, some of the natural solutions, dietary changes that I went over may be really helpful in making that transition. So hopefully this video helps you better understand some of those long-term health consequences of being on PPIs. And if you do have questions on anything here, drop it in the comment section. I'm happy to answer your question. If you're looking for more personalized health guidance on your health journey, consider joining the Insiders, where I'll have more time and attention to dedicate to your question. You'll also be supporting the channel and have access to other resources. Now, one question you might have after watching this video is, what do I really need to do to make my acid reflux go away? And you can watch this video right here to get a better understanding of that. Thanks again for watching.